This is Type 1 Diabetes by Seth Hudson. So what is diabetes? First, let's talk about insulin production. Insulin is produced by the B cells found in the pancreas. In Type 1 diabetes, the T cells of the white blood cells attack these beta cells producing insulin, which is why it's called an autoimmune disease. Our body physically attacks itself. So when there is no insulin production, glucose can't enter the cell and use it for energy. Therefore, our cells are starving. A couple things to look for in patients with type 1 diabetes would be hyperthyroidism, which again is another autoimmune disease. This is caused when the white blood cells, those T cells, attack the hypothalamus gland. Also, hypothyroidism, which again is an autoimmune disease and occurs when the body attacks itself. One sign to look for with type 1 diabetes, one major sign of type 1 diabetes is diabetic ketoacidosis, DKA. This problem arises because the body can't use glucose as an energy source, and so it turns to an alternative. Our body then breaks down the adipose tissue in our body and uses that as fuel. When fat is broken down, the byproduct are called ketones. The body needs to get rid of these ketones and they are excreted through the urine. Therefore, some lab values that you can look for are creatinine and ketones in the urine. Also, with diabetes, it's good to monitor with blood glucose levels. Lastly, another test that can be done is called an H1C. This is done every 3 months, and the reason it's 3 months is because that's the average lifespan of a red blood cell. This tells you the average blood glucose level a patient has had throughout that time. Unfortunately, there is no cure for type 1 diabetes, and patients are faced with one of two choices. They could have a pancreas transplant and be put on anti-rejection medications for life, or what most people like to do is use insulin. This is a synthetic form, and it's injected prior to meals and depending on the type of insulin you use. No matter which treatment the patient decides to use, it's important to educate both the patient and the parent, letting them know the signs and symptoms that type 1 diabetes can produce. One of those signs and symptoms would be hypoglycemia. This is when the blood sugar gets too low and the patient exhibits signs of sweat, they get shaky, dizzy, and grumpy. The alternative would be hyperglycemia, where the blood sugar is too high and there's not enough insulin. So signs would be extreme thirst, cramps, weak, headache, things such as that nature. The different types of insulin have different jobs. For example, Humalog is a fast-acting insulin, and that's used, it peaks in 15 minutes, and therefore should be taken 5 to 10 minutes before each meal. A pharmaceutical treatment that can be done is managing your diet. This goes hand in hand with pharmaceutical treatment. Patients with type 1 diabetes should be able to count their carbs and understand their glucose levels and what it means. NCLEX question number 1. A newly diagnosed child with type 1 diabetes receives insulin, suddenly experiences signs of hypoglycemic reaction. What should the nurse immediately give the child? The answer is A, 8 ounces of skim milk. The rationale is hypoglycemia is immediately treated with 15 grams of fast-acting carbohydrates. Other solutions, such as 1/2 cup fruit juice, 1/2 cup regular soda, 3 to 8 hard candies such as Lifesavers, or 1 tablespoon of honey, not a teaspoon. NCLEX question number 2. A newly diagnosed client with type 1 diabetes is taking Humulin and insulin at 7 o'clock in the morning. Which signs and symptoms should the nurse monitor the client closely for late in the afternoon? The answer is B. This patient is experiencing hypoglycemia. Because humulin peaks in 6 to 12 hours, the patient would exhibit signs of hypoglycemia. Other signs can be headache, anxiety, increased pulse, and blurred vision. Thank you.